have different type of the scalpels.
Sharp pointed scalpel.
Yeah, this is of course they are sharp, but if you can see the size, okay. This for incisions in deep under the skin, under the tissue, and we will hold it like this, like the pen. For example, look here. Under the skin tissue, we will palpable some fat tissue or neoplastic, and we have to cut it. We will put like this, hold, press, and cut it, and we will see like this. Okay. For the when we want to fix and see, we don't want to go deeper. Then we can hold our finger, and that we, when we cut it, we will hold, and we want to cut it, and we will fix our finger, and then we can go inside more deeper than we want. Okay. In this type of scalpel, we will do large incision. For example, laparotomy. Only skin and fat tissue. And we will hold like this. Okay, sometimes like this. You understand it? Clear? Yes. Hold it and go. I will do it. Large incision, but it's superficial, not deeper. Okay. And another type, like knife. Who knows?
Amputating.
Amputation. Yeah, we are doing amputation, and we will hold it like this. Okay. And we'll go like this. You understand? That's why you have to hold it in your hand. And for the incision, for the cutting, we are using, what do you think? What else with instrument we can use? What do you call this? Huh?
Scissors.
Okay. Scissors. Again, we can see another type of scissors. Sharper. Sharper. Yeah. And this is Cooperovsky. We are using this cutting the stitches, okay, not in the abdomen. And this is again for the removing stitches. We will see how we can use this. And we have scissors for the abdominal part. This looks like this, number 6. Number 6, yeah. Longer one, okay. And it's a little bit yeah. How you should hold in your hand, like this. You see? because not like this. You have to hold in your finger in this part, and you can do only your wrist working. Okay, and you are holding this very gently, and then you can cut it, and you can see the part of the things when you wanted to remove. And we can see the for the microsurgery scissors. You see it's very smaller one. It's used in a cardiovascular, and neurosurgeons using this part. This scissors a number 8 for the cardiovascular. Number 9, this is using to when you have a gauze and you want to remove it, you are using this one. If you see the part, it's not sharp, and you want to cut, for example, the clothes. Something has happened, accident, car crashing or something, and you remove the people, and you want to take out the clothes. Okay, you cut it, and this is using like that kind of, and you want to put the under part, lower part. It will not damage the skin. Sorry. Алло. Да. Здравствуйте. Да. Не, на работе, скажи.
Вон.
Да, надо ко мне. Не, надо ко мне, чтобы я заключение дал. Okay. Clear? Good. Let's say we can call it instruments, how you can help, the assistant can help the surgeon to do the procedure. This is like we call it zerkala, mirrors. Yeah. Why they are calling them mirrors?
To see the reflection.
Because this part, when the light is coming, and they can affect, and we will see the part, and if it's deeper, okay, we will see that. And this is this one, number 13, A and B, we call Farabev. Farabev. Yeah, Farabev. And another way to name these instruments is рана-расширитель. Рана is a wound. Расширять is like you opening the wound. Okay, opening and fix it. We use this in appendectomy. All small incisions in deeper in abdominal. Okay. This is hepatic mirrors. Hepatic.
Okay.
We fix it the liver. Okay. This we hold number 14, number B. We can hold the ribs. Okay. And this is bigger one, same like Farabev, a little bigger one. And we hold again the tissue, the skin, everything when we work in abdominal part. Okay. This is again the ribs. This is for sternotomia, cardiovascular. Okay. Sternum, you know what sternum? Okay. Tomia, when we cut it. Okay, and when open it. This is cardiovascular. Yeah. What do you think? What is this? Number 45. This is using in a this use neurosurgeons. Yeah, fix the head. Okay, when you do the craniotomy, this head should be fixed, and this is fixing the head. And this is all things for craniotomy. Craniotomy. Okay. Open the head, scalp. Okay. You hold it and do it. Oh, you can see a new version of this electrical. Okay. But you have to always. You have to know if you force a little bit, you can go inside the brain and damage it. Okay, that should be when you are doing in your hand. Okay, you can see how deeper you are going. And what's this? Not 49. What do you think? No, it's not stitches.
Chainsaw.
For brain.
No. For example, we did the holes, okay, in a scalp, okay, and then we have to cut this part. Then we put on this 51, number 51. This procedure, we are going in this hole and coming with this, and that things going with that, and then we holding in this part and then cutting the bone. You understand how it works?
But it's under cranium.
Yeah, under the bone. Okay.
You can able to cut with any type of bones, right?
Yeah, any type of bone. Okay. And we say the Pilajigli. The name is Pilajigli. Pilajigli. Yeah. And we will see another one. This 78. Okay. This is for the amputation. Yeah, we cut the bones too. So, okay. Yeah. Okay. Now let's see. Assistant part. How you call this?
Forceps.
Forceps. And forceps. Again, we can see another couple types. You see the forceps without this.
Linings.
How you call?
The sharp binders.
Sharper ones. Yeah. Where we can use this when we have sharper things in
Tissue, excision of tissue.
yeah, we have to hold the skin. Okay. Without sharper things, we are using this in abdomen. We can hold the intestine, the all tissues in abdomen. Okay. But only the sharper one, skin, fat, tissue. Okay, we are calling this anatomiczny pincet, anatomic, and we are calling chirurgiczny surgeon. Okay, two types. We will see again for the vascular neurosurgeon, but usually it's two types, for the skin and for the tissue. Okay. And very important instrument, this we are calling this all instruments to hold the blood vessel. Кровоостанавливающий. To hold the when you cut the vessel, it's bleeding. You hold the bleeding. Okay, stop the bleeding. let's have another name. This is mosquito, smaller one. Yeah, this is mosquito. Yeah, smaller one. Okay, when you hold and fix the vessel, you have to stitch it or tie it. Okay, because this part is damaging the vessel wall. Okay, this is musket. And we can see the Mikulic. We are using in Mikulic. We will see like similar one. Again, you see, this is the sharper one here. In Mikulic, we can use hold the aponeuros. Okay, holding the aponeuros. The sharper one. You understand? We call the Mikulic. Bilurod. This is dissector. Dissector. Dissector we are using when we want to pass for example, like okay. Imagine this is this one. Okay. For example, my finger, this is artery and veins, okay, and I want to separate the artery and vein, and I want, for example, do some operations for bypass or something. I need the only artery because they are going in a one facial capsule. This instrument, there is no sharp, okay, and I can separate in this type of opening a little bit the branch, okay, and go there separating, and after that I will fix the needle, not needle, and I will go like this, and the assistant hold this, put out, and then I will separate, tight. Okay, that's why we're using the dissector. So far so good.
This is a dissecting scissors.
Yeah, but it's no scissors. This is like you can cut. You can just only dissect and separate. Okay. Let's see this part of how you call this is.
Suction.
These two are using for the tracheostomy. 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 Okay. This instrument 41. What do you think? In which reason we can use this one?
What transfer?
Hold the tongue. Epilepsy. Epilepsy. Yeah. We should hold the tongue. And this is holder of the tongue. This is number 44. We are using for the tracheostomy, holding the trachea. Holding trachea. Cutting the trachea. And then 42. Dissect a little bit the hole. And then put the tube. This is all instruments that we can use for the tracheostomy. Tracheostomy. Okay? What is catheters? number of this yellow one, and yellow number 40 and B, where you can use these catheters. Urine, yeah. You can put in urine bladder. This one too. Usually we are using this, putting in the stomach. Yeah. For example, cancer. Cancer, you can operate. No operating cancer because of a lot of metastasis everywhere. Yeah. But the cancer in the esophagus. Okay. And the patient can eat because the esophagus is closed of the cancer. We are putting this catheter and feed from this to the stomach, and then patient can live. Okay, without food, no, but this is helping the patient to live and giving the food from this tube. Okay, and in the future we will. Everything is okay. In the future, we will see type of the gastrostomy, how you use on this tube for the permanent or temporary. Okay. These catheters, intravenous. Catheters, intravenous. Nowadays, you know, the endovascular, everything is we are doing in endovascular. Stent, put the stent in the heart, yeah. When coronary arteries, stent in a bile duct, all this using catheters. But this is only intravenous. Intravenous in subclavian catheters. This part of instruments, I don't think you will see this is in operating room. Maybe in Russia, maybe in some of the out of the city, couple of hospitals you will see. This is for the intestine to anastomosis. You will see this one, number 34. There is not closed tightly. Yeah, this is for the part of intestine that should be in the abdomen. You don't want to cut it and throw it out. That's why you put this, using this instrument, the part of the intestine that you wanted to leave in the abdomen. This one, when you put it, then you have to remove that part of intestine because it's crushing, damaging the part of the intestine. Okay, but now we are using this kind of instruments to do anastomosis. You see, in that area, this opening. Do you put the intestine between two of these layers and like close it? And it's like metallic stitchers is going and holding permanently. It's a couple of minutes and you do the anastomosis. That's why you don't want to see. I mean, yeah.
So what's the function of it? Function to
close? Yeah, the function is, for example, again, cancer and intestine. Yeah, and you wanna cut it. You first of all, when you're cutting, you should close the hole because the all inside the intestine it will come out. Okay. That's why you have to close it very tight. And this instrument for that, you put between these layers the intestine and use it like a gun.
Okay.
Okay, and between these layers there is a step like that, and there is holding all the layers and all the part of intestine. And then you can cut it. Okay, you do it two sides. This is the cancer. Yeah, you hold it, fix it, cut it, and throw it out. Okay, and then these other parts you can stitch together. For stitching and using this one, you see how it's working. For example, in a part of the intestine, you will open it. One part is going up, one's down, and it's put together, stitch it, and it's anastomosis.
So what do you call this thing?
Сшивающие аппараты, stitches apparatus stitches. All these stitches apparatus. Yeah. This is we are calling retractor. Retractor, yeah. Using, for example, for the amputation, you cut the bone, and then when you want to cut the bone, you have all the tissue. You have to not remove, like this is you cut, you have an amputation, yeah, and this is all tissue. You have a little bit remove it, like clean it, move it, okay, and then you will see the bone.
Oh, clean the
And
flesh.
then and then you cut the bone a little bit more, yeah, and then when you remove this, the old tissues come back, and then you can do the culture, fix it, hold it, because with the bones, because in the future bone can grow and then damage the tissue and go out. That's why you have to cut bone a little bit more than tissue, and this is helping to remove the tissue a little bit more and cut more than the bone. Understand?
Yes.
Okay, and we did all procedures, okay, and then we have to close everything. We open it, we did it, and then we have to close it. We are using sutures. Sutures we are calling атравматические иглы. Атравматические. Atravmatically, when again this kind of features you will not see because there is no needle. Atravmatичные, when the needle and stitchers is coming, like holding this part of the needle. If you see, this part is more bigger than this one. And when you go all the tissue, you are damaging the tissue in this part. That's why we are calling this неатравматичные. Atravmatичные, when the needle hold the stitch. Needles can, we'll see, this is like a sharper, колющие и режущие. Yeah, but this we are using in the tissue. This one
Guna dalam tisu.
58, you will see it's like the the shape of the trigonum.
Needle.
Okay, this is like the point. Trigonum we are using with the skin, with the fat tissue. But the when is the point like this? Using in a tissue like a muscle, like intestine, all organs in a abdomen. How you can how you hold in your hand this, like you see how holding, not like this. Okay, this one. Okay, and we have another instrument, the holding sutures. Like this. See? And I will show how we can stitch it. Just a second. Just a second. Да, атравматичное, вот то, что я хотел показать. You see? Needle coming with it. Fix the needle. And this is like trigonum. And you will see the part of, you see? Using for the stitchers skin, fat tissue. Okay, let me show how you will stitch that. Okay, let's see. This one. Closer. Look how I'm using. You hold the skin and fat tissue less than 1 centimeter. 0.5 approximately. Okay, and then how you see, and another way, it's normal. You can hold like this. Two type of, like this and like this, under the instrument, and then you can two types. You can hold the needle. Of course, you always should fix the needles, and then it's opening, but your needle is holding. Then hold the needle. Again, opposite side, under the instruments, hold the needle, see? Clear? Okay. 3 types of узлы. Tie. Holding like this. One is going like. Put your finger. This is classic one. Understand? Again, this is classic one. again. Hold the needle. See? And very important part, it should be not like this. It should be in the side. Okay? And of course, not one and three times. Three times you have to knock it. This is classic one. We called the different type, what like this one, and again one. Should be two. Okay, this part is holding very tightly. You see, because skin is elastic, and you want to hold it. You need two times. Two times. And of course, in a hospital, in a operation room, you will see like this. For example, this is not skin, deeper in a wound, deeper in the abdomen, and the needle is very short. You can go and stitch it with your fingers, okay, and you're using the instruments longer than, for example, I will do that like this here, okay, and go deeper, hold the part, okay, and fix it. Of course, you can see another type of like this. Okay, but that's again, this is you can do your type of knot, yeah, but classically should be like this. Okay. For example, I hold it, okay. In 7 days after, you have to remove stitches. How you will remove it? First of all, you have to look here. To cut the needle, you have to put like this and then switch it, turn it. You will see it's not shorter and it's not longer. The part of the branch. Okay, after 7 days, you have to remove the stitcher. You have to cut. This part is, we are calling this infected, because this, not open, yeah, this is contacted with the tissue, with the air, with everything. Then you have to a little bit fix like this, and under the knot, yes, cut it. And this infected part, it will be on top, and you remove it. That's it. So far, so good? Okay. Okay, there's the tables, okay, and you will see the needles there. Tape needles.
Wait.